Hello everyone, and welcome to the fifth Talking Tuesday video series where we review frequently asked questions and topics specific to health links and coordinated care plans. In this session, we'll be talking about goal setting and how to complete the My Goals and Action Plan section of the coordinated care plan. Before we begin discussing the FAQs, we want to provide some reminders of the guiding principles to be used for consistency in coordinated care planning. So for one, as many of you know, goal setting is the foundation of the coordinated care plan, or the CCP, and the client's goals should be what drives all aspects of coordinated care management. The team-based approach is the second guiding principle. The CCP should be developed in collaboration with partners, patients, caregivers, and substitute decision makers wherever appropriate. The CCP should reflect the client's stated values, their beliefs, goals, needs, as well as preferences. This really ensures the document is truly client-centered and is what makes the CCP a unique communication tool. When goal setting, it is important to utilize the client's strengths and identify any barriers that would impact their ability to attain their goals. The fourth point, it should be written in clear and plain language using the client's own words wherever possible. The coordinated care plan should be easy to understand for the client as well as members of the care team, including family members. While clinicians may use clinical language in their organizational record management systems, the CCP should use language that is accessible to the patient and not necessarily healthcare professional supports. Literacy, which does include health literacy, should be kept in mind when completing the coordinated care plan. Now that we have reviewed a few fundamentals to ensure a client-centered approach to coordinated care management, let's jump into the frequently asked questions about goal setting. The first question we often receive is, how do I document goals in the coordinated care plan? So goal setting can begin in the early phases of coordinated care management. As you do begin to engage the client in conversations regarding a coordinated care plan, goal setting may be a natural discussion that is had between the client as well as the integrated care lead. You may begin by asking the individual, what is most important to you right now? And what is most concerning to you right now? These open-ended questions can lead the individual into expressing what is meaningful and really brings them purpose. We encourage you to use quotes to really capture the client's voice. You'll want to put the client's responses in the what's most important to me in my concerns section of the coordinated care plan. These responses are also helpful to guide the My Goals and Action Plan section and begin to document the steps to achieving the goals in this section. And don't forget that again, you want to use clear and simple language as previously discussed. So we're going to now review some helpful tips for when completing the My Goals and Action Plan. You can see on the screen here some helpful tips in regards to each column and specific questions being asked. So feel free to now pause the video recording to take a look at these questions and record them for your own purposes. Now that you have those questions in mind, we'll continue to show a completed session and what that would look like. So you can find the My Goals and Action Plan section on the second page of the Coordinated Care Plan at the bottom of the page. We will be going through a populated example so that you can also find it in the goal setting tip sheet on the second page. This provides an example of how a goal would be documented within a coordinated care plan. So we'll be going through each of the columns in this section of the coordinated care plan. To begin, you want to write a SMART goal under the far left column named What I Hope to Achieve. SMART is an acronym for specific, measurable, achievable, relevant, and time-bound. This example in the resource, I want to find a new family doctor in Niagara Falls by the end of May, demonstrates the SMART goal. The next section to the right of that column is what can we do to achieve it? So here you're going to list the steps and identify who is the most responsible for the action that will be taken to achieve the goal stated in the first section. And again, keep in mind that you want to use clear, easy, and simple language. The middle section here is called Details, is basically an update section. So as you begin to complete the steps in this section before, you will put the updates here. You'll want to put them in reverse chronological order so that the most recent update is at the very top of the page and the latest, most out-of-date date is at the very bottom here. Again, keep these simple as it only refers to the CCP and the goal listed in the far left column. Remember to put the name of the person providing the update in brackets so that others are aware of who entered the information. Refer to resources if you have any sort of questions. We'll provide those at the end of the slide as well. If you have access to HPG, then you can add your updates to this section as needed, and a notification will be sent to others on the care team who do have access to HPG as well. If you don't have access to HPG, you will want to ensure you update your personal copy and then contact the integrated care lead to inform them of the update that's taken place. You will then fax the updated portion of the coordinated care plan to the ICL to be distributed to other care team members. If the goal has been achieved, you want to ensure that it is clearly identified in the details section. The next section is named Who Will Be Most Responsible. This section is to detail who on the care team will be supporting the client in achieving their goals. This really does ensure accountability for everyone on the care team. So again, here you can see Carolyn is the client and Shannon is the lead, very clearly outlining who is who. The last section is called Date the Goal is Identified. So this is the date the goal was originally identified. It provides a timeline and context for anyone that reads the CCP. Once a goal and action plan is identified and documented, this would be a natural opportunity to ask the client how confident do they feel that their care goals will be reached. This question is located in Appendix 5 of the paper copy of the Coordinated Care Plan and is a required question on the HPG initiation/update form. Another question we are frequently asked is what happens once the client has achieved their goals? So once the client has achieved their goals, you can begin to assess their readiness for transition to self-management or new integrated care lead if needed. This would be an ideal time to hold another care conference in which the client can provide meaningful input into creating new goals and establishing an appropriate care team. We do recommend not deleting any goals, even if they are achieved, as this provides historical context for other care team members to review. Another question we are often asked is what happens once the client has new goals and they are no longer needed on the care team? So as we do all know, the Coordinated Care Plan is an evolving document, so this is a very natural progression in the client's journey. You may come and go as part of the care team depending on the client's goals and needs as they continue to change. Once it is established that you are no longer required to be part of the care team, the client, the integrated care lead, and care team members should all be informed of this change. Again, this can be discussed in the care conference that we spoke about earlier. For coordinated care plans on paper and in HPG, the consent form will need to be updated and faxed to all members of the care team. For those on HPG, both the consent form and the initiation/update form will also be needed to be updated and faxed to the LIN. This process ensures that only the current care team members have access to the coordinated care plan. The last question we are asked frequently is how often should I be updating the goals and action plan? This question is often asked to understand the time needed to continue to update the use of the CCP. You will want to update the goals and action plan as progress is made towards achieving the client's goals, or as well as if a new goal has been identified. So you will also want to update the coordinated care plan when there are major changes in the client's condition or the goal itself. The CCP is a way to formalize updates that you may have already been provided to care team members in your daily practice. You really will want to ensure the updates coincide with the client's goals and towards the steps in achieving those goals for the client. So now let's take a look at some other resources that you will be able to find on this YouTube channel. So the document named Developing Patient-Centered Goals is a guide of how to set goals with the client and provides examples of goals with suggested action items. Oftentimes patients have difficulty articulating what is really most important to them. Even the words goal setting can be perceived as daunting sometimes and potentially unattainable for a patient with very complex care needs. So this 2-page resource provides guidelines developed to support providers as they support patients when goal setting with their care. And the final document that we're going to look at is called Coordinated Care Planning Template Tips. So this document goes through the CCP with guidelines on how to fill out each section and prompts for conversations and questions with your client. So remember that you should get consent before starting a coordinated care plan and pre-populate the consent form with its core partners in mind. And lastly, key takeaway messages. So setting SMART goals should be based on the client's responses to the following section in the coordinated care plan. What is most important to me and my concerns? And some questions that you're able to ask around that are, what is most important to me right now? And what concerns me the most about my healthcare right now? So feel free to ask your client those prompts. Use quotes when possible to demonstrate the client's voice and wishes. And refer to slide 2 of the goal setting tip sheet for examples on how to document each under each of the different subheadings. When a client begins to achieve their goals, assess their readiness for transition to a new integrated care lead, or if they're self-managing, a care conference is encouraged when new goals and action plans will be established. The coordinated care plan is meant to be a document that demonstrates progress in the client's goals and action plan, the care team members, as well as the integrated care lead. And lastly, updates to the coordinated care plan should be made when there are major changes in the client's status or changes to the care team, the ICL, and when progress has been made in reaching the client's goals. Thank you very much for tuning into Session 5, and stay tuned for Session 6.